Welcome to the University of Missouri Kansas City Psychiatry Training Program. I'm Dr. Bini Murthy, the Training Director. Our goal here is to train the next generation psychiatrists who are knowledgeable and can offer compassionate care. Our learning environment here is pretty unique and diverse, and with experiences that we offer both in our forensic hospital system as well as the university hospital systems. Our training environment also has diverse faculty members and multiple opportunities to learn from interprofessional team members. I hope that you can catch a glimpse of our program as you speak to our trainees and our faculty. Thank you for your interest in our program.
Welcome. My name is Ferdinand Osiande. I am a PGY4 and current Chief Psychiatry Resident at the UMKC Psychiatry Residency program. Here in our program, residents can expect to experience a wide variety of clinical experiences, both in the inpatient and outpatient setting. When residents first come to our program, they're assigned a buddy that will not only take them throughout their first year of residency training, but also a buddy will work with them for their first few shifts of call during the first few months. And so this buddy will make sure that they know our system inside and out, so that once it comes time for them to do call on their own shifts, they feel most comfortable navigating the system, answering pages, answering overhead pages, and also being able to meet with patients for evaluations.
Hello, I'm Dr. Timothy Dellenbaugh. I've been a faculty member for the University of Missouri Kansas City for the last 24 years. During that time, I served as residency director for 15 years, and presently I'm the medical director for Center for Behavioral Medicine. We are a state-operated hospital that is focused on caring for individuals who have mental illness and have been found incompetent to stand trial. We pride ourselves on having a collaborative atmosphere and strong interdisciplinary treatment teams. This allows residents to focus on learning to take care of individuals with severe mental illness who also have particularly complex psychosocial environments.
Specifically, I've been on CBM for the last few months, and everybody either gets 2, 4, or 8 months at a time. So CBM, you're really going to get a lot of continuity. That's been the best thing that I think about this, is that I haven't gotten in the past, is I'm seeing these patients from the day they walk in till the day that they leave, whether that's a week, 2 weeks, or a few months, and that's an invaluable experience.
Here at Truman, we have 2 acute psychiatric units. We have a downtown unit that has 2 25-bed units, and then at the Lakewood Hospital, there's a 16-bed unit. The 2 25-bed units downtown is where you will spend time as an intern. There are several month-long rotations. You will carry between 4 and 8 patients, most likely. Those are acute patients. We are a safety net inner-city hospital, so we're dealing with some challenging patients who can be quite sick, suffering from primary mood, thought disorders, sometimes anxiety. Suicidality is often an issue, and substance use is comorbid with most of our patients. You will get a lot of experience interviewing patients, learning how to provide crisis stabilization, both psychopharmacologically and with non-medicinal interventions. We deal with acute psychiatric issues when we're helping the emergency room figure out what to do with the patients that present there. Obviously also working when there are acute medical issues and acute psychiatric issues that are affecting our patients. On that rotation, I really strive to help you learn independence, whether that means working with the patients, working with your co-resident, and working with the medical staff.
The really nice thing about our program is you're paired one-on-one with an attending, so you get a lot of exposure with them. We have some pretty sick patients. We're the safety net hospital in the city, and so a lot of our patients are really sick, haven't been adequately treated, so some real challenges and some people who really need help.
We have our consult liaison service, which we do a little bit during second year, and as a fourth year we run the service essentially with the attending, but we assign cases to the junior residents, and of course we see consults, and consults are requests from other services in the hospital for psychiatric needs.
I do a lot with the residents as one of the program directors. I also supervise some of their third-year clinics, and then I am the team kind of supervisor and put together a community rotation for the fourth year where you actually get out of the office and you get to go into the community and you see patients in their homes. You get to go out with CIT officers into like homeless encampments, and you get to see some of the public and community side of mental health to try to gain a different perspective that I think is really unique to Kansas City and unique to working in a downtown urban area.
Our third year of residency training, we do an entire year of outpatient in the University Health Healing Canvas building. It's in the Crossroads section of Kansas City, which is a pretty great part of town. There's a lot of arts and different restaurants and kind of things to do around that area. So it's a pretty exciting place, and I really like the patient population we work with. It is a safety net clinic, but we see a large variety of individuals across the socioeconomic spectrum and from different parts of the Kansas City metro area, rural areas, suburban, kind of urban parts of town. And so you get to see a really wide variety of different patients, which is a great learning experience, and I've so far really enjoyed it.
Well, here at the University of Missouri, Kansas City, the residents spend their third year and part of their fourth year working in our outpatient dual diagnosis clinic. That's a clinic where we work as part of a multidisciplinary team. So we have caseworkers, vocational rehab specialists, individual counselors, and then psychiatric services to provide comprehensive care for patients with substance use disorders and mental illness.
In this clinic, the residents have the opportunity to learn many different kinds of psychopathology on patients and learn how to treat them and manage them, not just with medications, but also with play therapy and other kind of psychotherapy approaches according with the cases.
I've really been enjoying the variety of patients that I've been seeing. I've seen patients as young as 4 years old and as old as 18 with a wide variety of conditions like ADHD, autism spectrum disorder, separation anxiety, and it's been really rewarding to see them build a relationship with them over time.
So the research track typically starts like every other track in the third year. I was able to, again, because the program is pretty flexible and willing to accommodate residents, I was able to start as a PGY2. It essentially involves a day that you have specifically tailored for you to complete any research work, any course activities, because along with the research track, you get to get a certificate or a master's in bioinformatics through the UMKC School of Medicine program.
So I'm currently in the health track. It's for a Master's of Health Professions Education. And really it's an opportunity that this program gives during your last 2 years of residency, so PGY 3 and 4, the program will actually pay to get your master's degree. So anyone who's interested in teaching, whether it be like a clinical director for a psychiatry clerkship, or even getting involved in program leadership, assistant program director, any field or where you're wanting to teach, any aspect of teaching, leading, creating assessments, that sort of thing, this program allows you to do it.
The psychodynamic track is something that residents have the option to join in their third year, and it's affiliated with the Psychoanalytic Institute of Greater Kansas City. So it's a 2-year track where we attend seminars on Fridays in the afternoon with the Psychoanalytic Institute. We start out in the morning by doing a clinic where we have our own therapy patient panel, and then in the afternoon we go to the Institute and attend lectures with psychoanalysts in training and kind of talk about theory and do readings by Freud and other psychoanalytic thinkers. And then another part of the lecture series is going through a case presentation and analyzing both the patient and the analyst's interactions during the session.
Neurology is one of the courses that we go through as a PGY1. As a PGY, you will have a wide gamut of exposure to different neurological cases that will help you to improve your practice as a psychiatrist overall. I think it will help you to develop as well tolerance to neurologists prescribing certain medications. So that was extremely helpful.
You're working with the family medicine residents under an internal medicine physician. Definitely there was a lot of support. Everybody was very nice. And you kind of get to see how that plays into patients' mental health, because a lot of them are having underlying mental health issues as well.
So I think the medicine consult service is really unique in that you get to work on the medicine side of things while you're working on an inpatient psych unit. And that's not necessarily an experience you get a lot as a psychiatrist. So it puts into perspective like what kind of management you have to do for medical comorbidities while you're also managing patients that are primarily there for psychiatric care.
Well, I have a special interest in interventional psychiatry, which involves utilizing treatment modalities that is different from the traditional or usual treatments such as medications or psychotherapy. So this will involve treatments such as transcranial magnetic stimulation or esketamine or electroconvulsive therapy. So for our residents, they'll have the opportunity to have hands-on experience in these treatment modalities, which gives them a broader scope of treatment for their clients going forward.
I think it's a really good opportunity for third-year residents to be able to integrate CBT into their med clinic visits. And so we teach them how to do therapy, but also how to apply that later on when they're just seeing patients, whether that be inpatient or outpatient, and to utilize those techniques to enhance their visits.
And I think they get a really great opportunity to learn from people that practice evidence-based practices in psychiatry medicine, as well as in more of the therapy.
One of the things I've found most valuable in the outpatient setting is being able to do a combination of psychotherapy, everything from cognitive behavioral therapy. Every Monday we work with several PsyDs, PhD psychologists in order to discuss different tactics and invoking psychotherapy with patients, CBT, and then that's something that I've been able to utilize quite a bit in addition to doing some of the medication management for depression and anxiety and other common sorts of psychiatric illnesses we see in the outpatient clinic.
In our fourth year, we have 6 months of required core rotations and then 6 months of elective rotations. One of the great things here is that we have a really wide variety of electives you can choose from or even make your own. If there's something that you're particularly interested in, you can make that. I believe one of my co-residents this year is doing eating disorders, which is something unique that we're doing in conjunction with Children's Mercy Hospital just across the street. There's also opportunities to do sleep medicine, which is a fellowship off of psychiatry and other fields. There's an opportunity to do pain medicine, which is a very unique opportunity for psychiatry residency programs in the country to get hands-on experience in doing pain procedures. We also have educational rotations where you can spend your time coming up with didactic material for the lower classes and help teach them for the board exams. And we also have administrative electives where you can learn how to be an administrator within healthcare, which is, very important for physician-led care in the future.
I love working with medical students because I'm not that far from medical training myself. I love that I get to further my own knowledge as well as help students understand the things that I kind of struggled to understand while I was in medical school.
I really like the mentorship aspect of medical student teaching. That's kind of my favorite part of interacting with medical students, is being able to tell my story, how I chose psychiatry and how I navigated the challenges of every step of medical school, being able to help out in any way I can with their journey.
Our didactics are unique because we talk about everything ranging from psychoanalytic theory during our first 2 years to very practical things like how to handle FMLA and short-term disability paperwork in the outpatient clinic.
One of the things I enjoy about our didactic lectures that we have is that we're able to take a pretty deep dive into a lot of the research behind a lot of the clinical decision making that we're having to do on a day-to-day basis. We have great faculty here that have a lot of information to share regarding best practices and kind of latest evidence-supported clinical decision making for everything from treating schizophrenia to more kind of common illnesses that we see in the community like insomnia, difficulty with sleep.
I think that didactics gives not only the fact that you get a lot of support from your attending and your supervising physicians during that protected time, in that they completely give you that protected time to go and focus on furthering your education, focusing on learning more about psychiatry. But one class that was really fun was the DSM-5 class that we did, where we would talk about specific criteria for DSM-5, and we would even act out roles and do like practice patient interactions where people would be kind of exhibiting the symptoms of certain DSM-5 diagnoses. So that was a really cool experience in didactics so far.
We have a new residency program director. Dr. Morty is very open to ideas. She'll ask residents questions, how they're doing. Even before she became the program director, the program is all about residency wellness or resident wellness.
The best thing about this program is going to be our program coordinator. Her name is Sherry Bushmore, and she is absolutely incredible. You'll get to meet her for anybody that interviews with our program, and she will be right by your side until day of graduation. She really makes sure that any forms that need to be turned in, she's there. If anything is going on in your personal life, she's more than willing to sit down and talk to you about it. She's really just shoulder to lean on. You're really a staple of our program here.
One of the other big deciding factors for me is that I really love the city. Kansas City is a great place to live. Cost of living is also a good deciding factor. I used to live in Boston, where it has one of the highest cost of livings in the U.S. Here, I was able to actually buy a house and able to have my dog run around in the backyard, and being able to have a little bit more space was also kind of nice. And it's somewhere I hope to stay for some time to come.
Kansas City is pretty great. One of the things is my husband has been a lifelong Chiefs fan, and he grew up here. I did not. And I was essentially made into a Chiefs fan last year, and I love that my first year here, the Chiefs won the Super Bowl. So there's a lot of really great things going for it. A lot of great food, a lot of great activities. It's not too small, not too big, in my opinion.
It's difficult, but it's definitely doable. I feel like everybody's been very supportive and accommodating to me. The hours here are great. And so it was a perfect fit for me as a mom. I'm able to drop off the kids in the morning, and most of my rotations start at 8 o'clock. And I'm able to do pickup at 5 p.m. So aside from the weekend call schedule, it actually works very well for a family. I can't think of another program that is more accommodating.
When I think about work-life balance, I'm thinking, how am I able to spend my time outside of work doing the things that I really enjoy doing, such as my hobbies. My personal hobbies include working on vehicles, building things, lifting, and honestly doing a lot of just active sports like pickleball, which has become huge now here in Kansas City, as well as flag football and sand volleyball, which I picked up not too long ago.
The call schedule over the weekend is actually very nice because you get to decide which weekend you're going to work. You and your other co-residents from your class kind of make up the schedule. So it's very flexible, and it is what you want it to be.
I've been going through a wedding at the same time, and I think that, you know, with that being said, I've still had a ton of time to spend with family, spend with my wife, and spend by myself too.
The program allows you to have a good work-life balance. I'm in my third year now, and I work Monday through Friday, 8 to 5, and work every 6 or 7 weekends. When I'm not at work, you have all the time in the world, not just to study and be a better doctor, but also go out with friends. We have really nice restaurants that are here. The art scene is really nice.
The work-life balance is pretty great. In my PGY1 year, I felt like I was learning a lot, seeing a lot of patients, absorbing a lot of new information, but also living a totally normal life outside of residency.
With UMKC's program, since I went to school here and I really wanted to stay because I knew the faculty and I really liked working with them. But I think the best thing is that since it's a small program, people are able to work together on a level that feels not like attending and resident, but more so like an actual team.
The diversity here was a big point for me. I feel safer as a minority person around people from all over the place. I don't want to stand out so much. So I love that the teachers, the attendings, the nurses, the techs, even and the patients, they're all from all over the world, really. And I love that, you know? I love getting that experience. I don't think any other hospital here in the city has this. This is like the representation of the world right here.
It really is our faculty here. So I did medical school at UMKC as well. I worked with several of the current faculty members that are here. I find it to be a really opening environment. A lot of the faculty here don't just want you to do what they want to do for the patient, they really want to hear your input. I feel like the supervision here is adequate, but they also kind of let you be your own person.
There's a really supportive camaraderie in the program. I think that there's a really big sense of friendship and support in our residency program, and I think that that's something that's hard to capture virtually, but it's something that I really love and what makes our program special.
And there are many good things to talk about UMKC, but one thing that I found is the staff is extremely supportive. Not only the attending physicians, but the nursing staff, the social work support, the techs, like everyone is so nice here. Everyone, like every day I genuinely come in and I'm excited to come into work. I'm excited to work with them. I've made like good friends here already, and you know, they've just been so supportive in what could be perceived as a really tough time while you're transitioning from medical school to being a professional. So I think that that's one thing to be said for sure, is that the community here is one that's very vibrant and supportive.
I feel like everyone in this program is very friendly and kind of community oriented, so I know I'll be in touch with a lot of these people even beyond residency, and I'm looking forward to that.